So for patients undergoing CAR T therapy, you need to monitor the patients a lot, and this entails checking vital signs frequently for fevers, also monitoring their vital signs for hypotension, implementing or administering acetaminophen when they're experiencing fevers. You can also take a look at some inflammatory markers like CRP and ferritin. Those usually rise when cytokine release syndrome is coming up. Assessing the patient for neurotoxicity, so doing neurochecks or the CARTOX-10, and basically letting the treating physician know when any symptoms arise so that treatment of the patient can promptly happen. The nurse is crucial because they're the front line. They're the ones at the bedside that are assessing the patients and monitoring the patients. They're the ones that are more familiar with the patients and see the patient on a daily basis. So basically they're the ones that are going to notice the symptoms first and inform the treating physician so that the treating physician can treat the symptoms. I see that as, they're going to play a more integral role of the patient, and it's more of a collaborative event. Basically you have the nurse and the treating physician that are going to work together to manage the symptoms of these patients. And I think as more therapies come out and this therapy has more time, with different physicians treating the patients, I think that the role of the nurse is going to evolve and it's going to get better. So, there really isn't a whole lot of educational material for the nurses at this time. I think the best thing to do would be to take a look at Kymriah and the Yescarta box label to kind of get information from that. I think as this becomes more mainstream and more FDA approvals for different diagnoses, I think that there'll be a lot more information and a lot more education for the nurses to come. But I think for the nurses right now, it's basically just educating them from another nurse who's more familiar with the therapy and just basically letting them know how to manage the patient. So basically it's just the nurse that's going to be training the nurses.